You might think antibiotics work right away, but that's not always true. So in this video, I will show you how long doxycycline takes to truly work. Hello, I am Dr. Fuller, medical doctor as well as certified sex therapist. Doxycycline stops infections before they start. If you want to learn more, check out our playlist linked below. How does doxycycline work? So doxycycline prevents bacteria growth after having unprotected sex within 72 hours. So after sex, it can help some people reduce their chances of getting syphilis, gonorrhea, and chlamydia. So how long does it take for doxycycline to work? So Doxy-PEP typically starts working within hours, but its protective effect is preventative. So it's taken within 72 hours after exposure to prevent syphilis, gonorrhea, and chlamydia. It doesn't treat symptoms, but it helps prevent further infection. So what factors can influence doxycycline's effectiveness? You have a couple: interactions with other medications or food, possible antibiotic resistance, severity of any infections that you might have, the strength of your immune system, and if you have any allergies, adherence to your dosage and timing. So how do you know that doxycycline is working? So you know doxycycline is working not by feeling immediate changes, but by not developing an infection. So here is how it's assessed. No symptoms developing. If you don't get an STI symptom, whether that might be bumps or any physical symptoms that might be showing in your groin area, that's a good sign. So for known exposure, if you have a partner that tested positive and then you tested negative, then you know that it's working. So remember that doxycycline is a preventative. So when is a good time to contact your doctor? After you're not seeing any improvements after 72 hours, if you're starting to have any sort of allergic reaction, such as swelling, breathing issues, your rash is getting worse, and it's always, even if you're not having symptoms, to follow up with a healthcare provider. So here are some key tips for effective use of doxycycline. One, you want to make sure that you're taking it correctly. Timing is everything. You want to take it within 72 hours of exposure. Ideally would be within 24 hours. So the dosage we typically prescribe is around 200 milligrams, but that is going to vary per person. The 200 milligrams is usually taken as a single dose. So here are some common mistakes that you want to avoid for taking doxycycline. Don't take it on an empty stomach. It can cause nausea. Avoid taking it with dairy, such as like milk or cheese. Stay upright for at least 30 minutes to avoid throat irritation. Also, while using doxycycline, you want to protect your skin. It's essential to use sunscreen. Also, make sure you don't overuse it. You want to use it exactly as it's prescribed by your physician. And you want to stay consistent with your sexually transmitted infection screening. So that means every 3 months if you're sexually active.